Yeah, we have preliminary data regarding the role of the microbiota composition in influencing the response to immunotherapy in different cancer types, including RCC. Then they moved trying to modulate the composition of the microbiota through dietary interventions, so live bacterial microbiota products, and they found the possibility to modify the composition of the gut microbiota, but also restore the response to immunotherapy. We have data about the FMT, so the fecal microbiota transplantation, not yet in renal cancer, but in melanoma cancer patients, and they are only small phase 1 trials. So actually, our study was the first randomized placebo-controlled study with FMT in kidney cancer.